Good afternoon, and thank you everybody for joining us. My name is Patricia Houston, and it's a pleasure to have everybody in this amazing, powerful, and educational Lunch and Learn. I just want to remind everybody that this Lunch and Learn is going to be recorded, and that you can use this video and share with families and providers. Today, I have the honor of having from the Mental Health Association of Essex and Morris Counties, David Mill. Along with David is a whole team, so I'm gonna allow everybody to introduce yourself. So David, let's start with you.
Thank you, Patricia. So my name is David Mills. I am one of the supervising prevention consultants for Mental Health Association's New Jersey Statewide Student Support Services Program. And that's just a fancy way of saying that I assist in overseeing the amazing prevention team that's going to be going out in the community and in schools to be providing mental health and prevention programming. And then next to me, I have Jenna. I'll let her introduce herself.
Hi, I'm Jenna. I am a prevention consultant for the NJ4S team, and I'm super excited to start getting into explaining everything, but we'll be doing the tier 1 and tier 2 type stuff that you guys are gonna hear about soon. So
Wonderful, thank you. Who wants to be next?
I can go on next. Hello, I'm Emily Savino. I am the Assistant Director for NJ4S at Mental Health Association, and we're serving the Morris and Sussex counties.
Wonderful, thank you, Emily.
Hi, my name is Natasha, and I'm a prevention consultant with the Mental Health Association and J4S.
Thank you.
Hi, everyone. I'm Jolene Windsor, and I am also a prevention consultant for NJ4S at MHA.
Wonderful, thank you.
Hey there, I'm Tasia Keppel. I'm the Senior Director of Clinical Services over at Mental Health Association.
Wonderful. Thank you, everybody. As you can see, we have an amazing team. So today, David is going to provide an overview about their services and resources. If you have any questions or something, we are going to allow time for Q&A. That part is not going to be recorded. So David, you're more than welcome to take the lead.
Thank you so much, Patricia. I'm going to go ahead and share my screen so I can share our slideshow we prepared for today. There we go. All right. So I'm here to just inform everyone of a brand new statewide initiative that is being spearheaded by the New Jersey Department of Children and Families that will be providing students and families prevention and mental health services throughout the state of New Jersey. We are representing Mental Health Association, and we will be serving Morris and Sussex counties. So some of the things we're going to touch on in today's discussion is kind of talk about youth mental health in the United States and in New Jersey particularly, and kind of why the state of New Jersey thought it was important to provide a statewide network of prevention and mental health services for students and families. We're going to talk about what this thing NJ4S is. It stands for New Jersey Statewide Student Support Services Program. That's where those 4 S's come from. We're also going to talk about this hub and spoke model that this program is, and what that means to be a hub and spoke model, and why this model allows for the most easy access to services for students and families. We're going to go into the tiered level of supports and services that NJ4S can offer to students and families, and kind of get in the nitty gritty of what's the difference between those, you know, what level of service is that, and you know, how that will service students and families. I'm going to talk a bit about the Mental Health Association's specific evidence-based programs that we will be using for our tier 2 level of service, and then we're going to leave some time for some questions and answers. So first, I'm just going to go into a few statistics on the youth mental health crisis. I'm not going to read these verbatim, but kind of, I think coming out of COVID, you know, there's always been a need for mental health services for students and families throughout the state of New Jersey. But I think the COVID-19 pandemic really showed how essential they are, and how important it is that students and families can easily access mental health and prevention services So that was the state of New Jersey response to the increased youth mental health crisis coming out of the COVID-19 pandemic. Now, this is like a brief overview of what NJ4S is exactly. So it is a statewide network of supports for students and their families. So this, there is an NJ4S program from the top of, the state in Sussex County, which we'll be covering, all the way down to Cape May counties. But Mental Health Association will be specifically servicing Morris and Sussex counties. But if, you are not a Morris or Sussex County resident, you still have access to these services by another provider. And NJ4S really is a response to the needs of students and families. The state of New Jersey and the agencies that are going to be providing this program are really providing the services based on what students and parents and families and community members are asking for and what they're seeing in their communities. It is a standard set of supports and services, but we will also adapt it to the needs of Morris and Sussex counties. Every county is going to be, the needs are going to be different. Every school, the needs are going to be different. So we are going to adapt to exactly what the schools and the communities need. I don't have to touch on that last bullet point. I think I kind of talked about it. So this green picture right here, this is kind of the visual of what a hub and spoke model is. So there's going to be 15 what we are calling hubs throughout the state of New Jersey, and the hubs are just mean an NJ4S program. The hubs will deliver services to youth and families exactly where they are and where they need services to be provided. So we are not asking any family or student or community member to come to us. We are coming to you to provide the services. So easily accessible. And all the services, I should have said this from the beginning, but all the services are 100% free. So there is not a cost barrier, or just because a student may not have insurance that they should be, not allowed to participate in these services. So you'll see this green picture here. So that's the visual version of hub and spoke model, right? In the middle, you have the NJ4S hub, that's us, that's this team. And then you have where we can potentially provide services, right? So if we get a request from a school, we're not going to ask them to bring students and families to us. We're going to go directly into that school and provide the services, based on the time frame that the school needs. Or maybe we might go to a library to provide a workshop to parents on how to identify when their child might be experiencing depression or anxiety, and that we could do, from 5 p.m. to 7 p.m. at a library. So it really is, there are no real barriers for students and community members and parents to access the NJ4S network. So this kind of goes a little bit more in detail from the hub and spoke model. So the hub is the administrative center. Like I said, that's us, that's our team. And then the spokes are the locations in the community where our team will be sent out to provide our prevention and mental health services. So on that first slide of what NJ4S is, I talked about how this is really, the NJ4S program is really driven by the voice of students, families, and the community. So we have an advisory committee that meets monthly that is made up of students, parents, community leaders, educators, service providers, and even other stakeholders in the community. And in those advisory committees, we talk about what is going on in the community, what's needed, and then we take the feedback from those stakeholders, and then we tailor our program to meet the needs that they're saying what they want this program to be. So we are not just in a vacuum talking amongst ourselves, being like, yeah, we think that this is what students in Sussex County need. We are actually getting feedback from students in Sussex County, from parents in Sussex County, from educators who are in the school, about what they need and what they want to see this program be. And then as well as an advisory committee, the Mental Health Association's NJ4S program has subcommittees too. So we have a youth subcommittee, we have a parent subcommittee, we have a data analysis, I want to call it, subcommittee, and a community relations subcommittee. So those are forums where the specific members, that group, can get together and really flesh out their thoughts and ideas, and then bring those thoughts and ideas to the larger advisory committees to really put forth what they think is most important this program provides. So now I'm going to get into the tiered level supports that we are going to provide. So there are 3 different tiers. We have tier 1, tier 2, and tier 3. And I'm going to start with tier 1. So the tier 1 level services are available to pre-K through 12th grade students, families, and school staff for public schools within the vicinage. So our vicinage that we cover is Morris and Sussex counties. But like I said, if you are not in Morris or Sussex counties, there is another agency that can provide services through NJ4S. And there's no referral required for tier 1 service. So it's a very informal process. For a tier 1 level service, a community organization, or say maybe a parent group, a parent support group, could reach out to Mental Health Association directly, and I'll have our contacts information at the end of the PowerPoint, and ask us, say if it's parents who have a support group for parents who have youth who are experiencing substance use, and they have a support group, and they want us to come out and provide training and workshops to them. That's a tier 1 level service that we could provide for 100% free to them. And the focus areas are mental health, well-being, positive peer relationships, job readiness, career exploration, classroom management, and many other things. It could be substance use, it could be suicide prevention, just overall social emotional learning and things of that nature. And actually, we are planning our first tier 1 level service for in a few weeks, and I'm just going to ask Jenna to kind of touch on that, because I think when you talk about this tier 1 level service that we're going to provide, it gives you a better idea of what that means. So I'm gonna hand it over to Jenna for a few.
Yes, I think I can speak on behalf of everybody on the team that we are super excited to let everybody know we do have our first event scheduled. So it is going to be a tier 1 service located at the Lakeland Hills YMCA, which is great because that location services many of our high need schools, as well as our mid and low need schools. So it's a really great reach. We're able to access quite a few schools that are listed on our needed, the schools that have needs. So our first event is really going to be centered around, since it is before school, managing back to school jitters. We're calling it a smooth transition, managing back to school jitters. And it's really great. So we're going to have the prevention consultants as well as the clinicians there to facilitate these workshops. And we're breaking it up into workshops for the kids and workshops for the parents. So we're going to have a couple options for the whole family to come. It's going to be fun. We are planning activities. We have pizza, some refreshments, and it's just a really good example of what this tier 1 service is going to look like. So we'll cover topics all really surrounding our main topic. So talking about anxiety, things that the kids can implement to kind of calm those jitters down. And then on the other side of things, educate and coach the parents that are interested on how to support their child and how to make the transition from summer back to school a little bit easier and a little less anxiety provoking. And like I said, it's just a really good example of what the tier 1 services are going to look like. And we're super excited to get started.
Yep. And there will be pizza as well. So I think that's an important piece too.
Point.
Yes. Yeah. And Patricia, I'm thinking once we have the flyer ready for that, we could we could share that with you, and you could send it out to your families that you work with so they can, you know, try to plan to attend if they can.
Please, yeah, thank you.
Yeah. All right, so now we're going to get into our tier 2 level services. This is a little bit more of a formal process to request these services. They also are a bit more focused and frequent than the tier 1 level services. So the availability is to students, families, and school staff for grades 6 through 12. So we will not be covering the elementary school age for tier 2 level services, and a referral is required for this service. So the way the referral system is going to work is the Division in Children and Families is providing us with a portal that we will have access to, and then a representative at your child's school will have access to. We're not sure who those people are yet, but once they are identified, we will be sure to inform you guys so that you know who to reach out to if you are interested in these services. So the representative at the specific school will put a request in, say they are seeing an increase in violence in their school and bullying. They will put in a request through that portal that will indicate that they want to receive bullying and violence prevention services. The Mental Health Association will receive that request. Then we will consult with the school to provide that service, and that is going to be in the form of an evidence-based program that is going to be a bit of a smaller setting. It's it can be a group of 5 students who have been really identified that they need this service, or it can be in a classroom setting of up to 30 students, where we would come in through multiple sessions, provide activities, and really great proven evidence-based programs to reduce, for example, bullying and violence amongst those students. And it's important that the evidence-based term here is really important, because these are programs that have been, the outcomes have been proven. So when students say go through an 8-session evidence-based program, it has been proven that they are less likely to engage in the activity that is being identified that is a risk factor for them. And then also a really important part too is that we are a connector service as well, if that makes sense. So say there is already a violence and bullying prevention program going on in the community that has been really successful, we would not take over for that existing program. We would simply let the school know that that already exists, and we're going to put them in contact with that agency that can then provide those services. And those focus areas are things like substance use prevention, sexual health and pregnancy, STI, HIV prevention, suicide prevention, anti-bullying and violence prevention, and a lot of other areas of need. We're going to be constantly tailoring those focus areas based on the needs of the community. Another thing I actually want to touch on is we are basing the evidence-based programs that we use based on a needs assessment that we have sent out into the community in Morris and Sussex counties. So educators, parents, and students are completing those needs assessments, identifying what they want, what type of services they want to be seen provided. And then we are taking that information into our research of the evidence-based programs that we want to use. And we are really focusing on those areas. And now our tier 3 level services, and these services are available to the same population that the tier 2 level services are available to, and that is students, families, and school staff for grades 6 through 12. A referral, again, is required. It's going to be the same process as the tier 2 level service. The designated person at the school would put in the request through that portal that would come directly to us. We would get in contact with that person, and we would consult with them to then provide a tier level service. And what a tier 3 level service looks like is a clinical intervention. That means a licensed therapist will come to the school or whatever setting it is that is easiest for that student or family to provide brief clinical services to them. And I do want to emphasize that this is not a crisis intervention. This is more of a student is just really having a tough time and they're trying to connect with mental health services, but the family's having trouble connecting. One of our clinicians would come in, meet with that students for maybe 4 to 8 sessions, provide clinical intervention. And then really one of the most amazing pieces is that clinician will then connect that student with long-term mental health services with a community provider that is already out there providing services. So that's our tier 3, and that's more one-on-one clinical therapy and intervention. And this is a list of our evidence-based programs that we are kind of like first list that we are going to provide through our tier 2 level programming. I'll go into each one briefly so you get an idea of what it would cover. So Safe Dates is a healthy relationships evidence-based program. SS Grin is a social emotional learning evidence-based program. So that just means that it really is meant to make students feel good about themselves, learn about their thoughts and feelings and how to cope with tough thoughts and feelings, and just help build them up. Lions Quest Skills for Action is a substance use prevention program that it kind of uses the model of building the self-worth of a young person so that they then can make better choices and avoid using dangerous substances and engaging in risky behaviors. Be Proud, Be Responsible is a HIV, STI, overall just sexual health curriculum. So really focusing on safer, sexual behaviors and things like that. Across Ages is another substance use prevention program that really focuses on resiliency and protective factors, and promoting those in youth to help them to make to decide not to use substances. QPR is a suicide prevention program, and this is one that would actually more be provided to parents and educators, because this is a program that focuses on how to talk to someone who you think might be having suicidal thoughts and ideations, how to support them, and how to refer them to engage in a higher, services to promote their mental health. Signs of Suicide is another evidence-based suicide prevention program, and this is more youth focused, so this would be provided to the youth. Mental health first aid is it honestly is exactly what it sounds like. It's first aid, but instead of your physical health, it's for your mental health. So that would be another one that would be more targeted towards parents, community members, and educators, so that they could better support the youth that they serve and their children's overall mental health. Second Step is a really great social emotional learning evidence-based program. Botvin Life Skills is another substance use prevention evidence-based program. Boys Council and Girls Circle is a really great program that uses a strengths-based approach and motivational interviewing strategies to just get youth together, talk about what it is like to be a high school age student growing up, and connect with one another and really help promote healthy decision making and things like that. We're Not Buying It 2.0 is a nicotine prevention program that really focuses on, I know vaping is something that is become really, really prevalent in schools and among youth. So it really targets that, and kind of like informing students on how to avoid starting to use nicotine and vapes and things like that. Preventure is another really great substance use prevention evidence-based program. So those are just some of them, but this is a living breathing list that will change as we get more input from parents, educators, and students. If there's a program that is just, it's not connecting with students, students are not engaging with our parents, we will definitely change this list and explore other options. So this is a breakdown of the NJ4S staffing team for Mental Health Association. It is a very, very robust program with a large team. So, we're going to be able to respond to most of the requests that we get because we have such a large team. And this is just the breakdown of it for those of you that might be interested in just seeing what this team looks like. All right, so these are some frequently asked questions that the Division of Children and Families found from parents and community members when NJ4S was really coming, in the very early stages before it even kind of like hit the public. So one of the questions is, won't it be hard for students to travel to a hub to get services? And I touched on this earlier on, but there will be no need to travel to an NJ4S hub to receive services. Really, the focus here is for us to respond to the needs of the student families and meet them at where they are to provide the services to make it as convenient for them, so there are no barriers to them accessing our services, which again are 100% free. My school district already has similar program, will our existing program be taken away? So this is a really important one because we will not be duplicating any services that already exist. So if there's something a school is already doing well, we will not step on their toes. We will not make them participate in our program. It is 100% optional. Schools will have to request the services, so we will not be, we will not force anything upon anyone. And this is a good question because this really relates to, I think, Morris and Sussex County in relation to some of the other counties that are close by to us, particularly Passaic and Essex. My school district is in a more rural part of the state. All the resources are typically go to the urban, more densely populated parts of the region. So this is really great because each region has its own dedicated NJ4S program. So in Morris and Sussex counties, Mental Health Association only can serve Morris and Sussex counties. And you saw that list of our team. We have a really great team and a big team that will be providing these services specifically to Morris and Sussex counties. This kind of touches on before, but this is going to be in addition to the existing landscape of services. So nothing is being removed. No services that already exist are being removed. NJ4S is simply there to cover bases and to assist in, there's a lot of students out there. So we're just there to fill in gaps and really help out those other community organizations that are already doing an amazing job providing services. And this is the end of our little presentation here. So, say if you're a parent or community member, you may ask, oh, but I'm not going to have access to that portal. How am I going to request services? So you can get in touch with our director of NJ4S over here at MHA and say if you want your child who is a student to be able to access those tier 2 and tier 3 level services, which require referral, you can reach out to us and we can try to get in contact with that school to let them know about NJ4S. Or you can just reach out to your contact that you have at your school and let them know about NJ4S, provide them our information, and then we can get in contact with them to make sure that we're connected and that they know they can request services from us. And then we also just ask, I talked about our needs assessments earlier. So it's really important that community members and those that work in schools inform us of what they want to see this program be. And you can directly do that by completing our needs assessment. So we have a community needs assessment. And if you scan that QR code on the left-hand side, it'll take you to a quick 2-3 minute survey. that you can complete, and then we get that information and it's able to inform our practice. And then on the right-hand side, if you work in a school or an educator, you can scan the one on the right-hand side. And again, it'll be a quick survey. It'll help us to inform our program and make sure that what we are doing is what you want to be seen in your communities and in your schools. So that is all I have today. Any questions? I'm gonna go back to the previous slide just so maybe this is up for a minute or two so people can access that information.
Thank you very much, David. I also want to remind everybody that contact information, website, and everything is going to be in the description box of the video. So if you need to get in contact, all that information is going to be right there. Again, I just want to thank you, big team, for being here with us. And definitely, I know the information that you're providing today is going to be very beneficial for our community and for those families in need. So thank you very much, everybody. Thank you.
Thank you so much, Patricia. We appreciate the time.
And with that, we are going to go to our Q&A session. That part is not recorded. Have a wonderful day, everybody.
Yep.